Doctor, did you find a simple columnar epithelium? Yes, I did. It was a three-dimensional view. And was there also a simple columnar epithelium view? Yes, what we call a surface view. And the ciliated epithelium was stratified, was it? Yes, it was a stratified squamous epithelium. What about the goblet cells? The goblet cells are simple alveolar glands, which are compound alveolar glands, as I said. It may occur as an acute self-limited episode due to food allergy, drug reaction, or emotional stress, or in chronic form as a characteristic feature of rheumatic and connective tissue disorders. Doctor, what is cryosurgery of the skin? Cryosurgery of the skin is simply the freezing of the skin with liquid nitrogen or solid carbon dioxide in order to destroy the lesion. And curettage of the skin is what? Well, that is the removal of superficial lesions with a skin curette. And, doctor, derm abrasion? Derm abrasion is the surgical removal of nevi or scars using sandpaper or other abrasives. What is electrodesiccation, doctor? Electrodesiccation is the use of short, high-frequency electric sparks for drying cells and tissue. Is that also called fulguration of the skin, doctor? No, fulguration of the skin is the use of long, high-frequency electric sparks for destroying tissue. What is the incision and drainage of infected skin lesion as referred to in your medical report? That is the Linton flap procedure, where the operation for stasis dermatitis and ulceration, refractory to simpler methods, is the all-incompetent communicating veins which are ligated and divided to relieve ambulatory venous hypertension in superficial veins. Doctor, does that prevent progression of dermatitis? No, it does not. Rather, it is the ulceration and pigmentation of overlying skin in the lower limb. What about local excision of the skin lesion? That is a plastic operation on the skin. Is that a surgical correction? Yes, it is a surgical correction of the defect. What is skin grafting? Skin grafting is simply the transfer of skin from a normal area to cover denuded areas. A dermatome may be used to obtain these skin transplants. Doctor, symptomatically, the annular or ring-shaped café au lait spots are what? They are light brown, flat spots, variable in shape and size, seen in neurofibromatous or fibromatosis, that is, von Recklinghausen's disease. Is that similar to cloasma? No, cloasma is referencing the patches of brown or yellowish pigmentation on a skin otherwise normal. What is a cicatrix, doctor? Well, cicatricial skin is scars left by a healed wound. And that is a cicatrization? Yes, cicatrization is the healing by scar formation. And the excretory duct of the skin is plugged by discolored sebum. What does confluent mean, doctor? It refers to the lesions joined or run together. Did this patient have a depigmentation? Yes, he had a depigmentation of the skin, partial or complete loss of pigment, which occurs in albinism, atrophic skin, and scars. What is dermatographism, doctor. That is dermographia, which is skin writing. Urticarial wheals appear where the skin was marked by pencil or blunt instrument. Would you call this a discoid? The X-ray shows a shape like a disc, which we call a discoid. Is it discrete? It is discrete. That is, the lesions are disconnected, separate from one another. What is ecchymosis, doctor? Ecchymosis is the purple spot or bruise due to seepage of blood into the skin. And is there an eczematoid or eczematous, eczema-like inflammatory lesion here? Yes, there is, and it tends to thicken to become scaly, vesicular, crusty, or weeping. Is that heavy enough?